Yeah. If I have to refer to one of these uh, developments that I think are taking the stage this in the last 2 years, especially. So I would talk about RNA therapeutics. This is something that has been advancing quite much and having a lot of impact in the field. So we saw it with the vaccines against COVID that was a burst for the field, and therefore RNA therapeutics, anything which is related to there have been some very interesting advances in that sense, and in particular for some advances that allow us to see a future in which the delivery of RNA, for instance, siRNAs or specific inhibitors against cancer intracellular targets might have a clear impact. So at the end, how to target intracellular molecular targets which are undruggable, this is a challenge. I think that the field has been seeing very interesting developments of, as I was saying, RNA delivery, which some of them in the form of lipid-based nanoparticles, some others in the form of self-assembled peptides or ligands for that. So those are very interesting. So that's probably what I would remark as the most interesting ones. Also, of course, there are others. Also, the use of methods that and carriers that might allow to have a more an immunological response, or try to immunomodulate the immune system which is compromised in cancer. So those are also very interesting issues. I would say that the most interesting thing for me is that we are, even if it's step by step and it's quite slowly, because the field is evolving. It's actually evolving quite fast, but fast in research is always slow for the rest of the world. But I think that the idea that being able to use nanomedicine to go forward to a more, let's say, to a medicine which is more better in the sense of being more precise is what we will contribute the most. I mean, it's not just the use of nano-carriers to avoid adverse effects of drugs and compounds. It's just the ability of having systems that eventually, even those are still in development, of course, and we are not there yet, how to use them to immunomodulate the immune system, for instance, how to use them to reduce adverse effects, to be more specific. Everything which is going towards precision nanomedicine, this is probably the most interesting thing in uses for that. So we always try to, I mean, we hear a lot about personalized medicine, nanomedicine, etc., which is good, because at the end it means that you will choose a treatment, or based on what you know on the disease, but you will choose a treatment. So it's the best one which is suited for that specific patient with that specific disease, because of the characteristics and features of that disease. So at the end, personalized medicine is fine, but if we go a little bit further than that, and nanomedicine might allow you to do that, and we go into precision nanomedicine, this is more chirurgical. It's more like a specific surgery, and that's precision nanomedicine. I think that will be something that will eventually really contribute to change the way we treat cancer patients.
Yeah.
We've been in the last 3-4 years, we've been working very much with this idea of trying to get something which is more precise in the way that we treat tumors, and that means that we have been working on systems that will allow us to improve how to inhibit intracellular targets that are undruggable. This is one of the examples that I was talking to you about. So there are many molecules and proteins and many systems and pathways inside a cancer cell that cannot be inhibited because targets are not druggable. So the idea of inhibiting those targets by using nanomedicine and delivering different kind of inhibitors, which might be proteins or antibodies, etc., that is something that to us is very interesting. And we have been working with that, and we have some nano-carriers that I think that in the next year or year and a half will have an impact in that sense. So I cannot give you very much details on them because of IP issues, but that is the most we have been working with towards. So inhibiting the cellular targets, and then also we have some new patents on the use of peptide sequences and as delivery as the active moieties for delivery systems, which are very interesting because they allow us to target much better certain types of cells, especially immune cells. In our case, for instance, macrophages or T cells, which are it could be really, really useful for immunotherapeutics and as you know, for using nanomedicine and immunomodulators. So those will be probably what you will be seeing from us in the next couple of years. What I would say is that look, my real background, I'm MD PhD, I'm a doctor. So when I finish my studies in medicine, I jump into molecular oncology. That's my real background. So my first years of research were mainly based on studying cancer, studying the biology which is behind, and most of our publications were based on new diagnostic systems, biomarkers, and genetic alterations, DNA damage repair systems, etc. So that was our background. So and I think that how we switch and change to a more to nanomedicine, it was based on the fact that it was a way to do something that to me at that time, and this was a personal feeling that I had. So I had that need of trying to do something that was more close to provide something that was useful, and to me that was important. So I decided that, well, it's okay. I mean, for sure, it was fine. I mean, working with molecular oncology, and I think that this gives us the expertise and the background that was ideal for trying then to develop systems that might bring new therapies. But the idea was, well, we need to do something else than that. So that was a personal feeling. I mean, this is when you talk about motivations at the end, you're talking about what is moving you inside to do something. So in my case was that I just wanted to do something that to me was more close to provide something useful, like a new therapy. And then for some reason I put my eye on nanomedicine, and I got more and more interested in the discipline and as much as the more I knew, the more interested I was. So that's why I decided to switch to nanomedicine and to apply nanomedicine initially to cancer, because that was our expertise, our background. So, but then we also open our applications and our interest to other diseases. And so rare diseases is also one that it's very much appealing to us, and also some other diseases in which there are clinical needs that are met yet, still, and we can actually make a difference with nanomedicine. But the end is always personal feelings and emotions that move you around. So, well, the first thing I would say is that 5 years is a lot of time. I mean, we've seen a lot of changes. The field is evolving quite fast. It's true that still we are facing the same issues that we did 10 years ago. So there's a lot of difficulties related to not just to how to design these new nanomedicines, but also things that have been, I mean, we have been talking about many times. I mean, there's a lot of talks about this and referring to how to address the scale up of the systems, how to produce them industrially. I mean, how to ensure that they are biodistributed in an adequate way in a human being, and which cells and animal models have to be used, etc., etc. So these have been on the table for many years, and still it is a problem for many designs. So and certainly those are things that you have to take into account very much when you begin to design a nanomedicine. Even not sometimes one of the most challenging things is to understand why are you doing that design and how this design is going to interact with a biological system. And so I think that one of these issues that, I mean, we're talking about many of them, that's true, about design, about production, about GMP, about many of these things. But I believe that we are not talking as much as desirable about the biology which is behind. I mean, I think that we still lack discussion on an understanding on biological systems. And by that I mean not just the cell models and animal models of disease that we will use for testing the nanomedicine, but also understanding which is the molecular biology that is behind the cell biology, how the system will interact in a living system, etc. This is something that is often forgotten, and then things do not work because this has not been properly considered. Even the methods, sometimes we're using methods and we're not questioning whether those methods that allow us to measure whatever it is that we're measuring, if they are the right ones, because the much we know, the much we realize that sometimes we have been deciding and taking decisions on how to proceed or how to go forward with a nanomedicine and with a design, and then we realized that was not meant to work from the first place because some of the biology was just forgotten, and because of that it will not work. So if I had to give an advice in that sense, I will say take biology very much more into account when you have to decide which is the nanomedicine that you want to design and for what reason. I mean, it's not enough in considering just issues that are related on how you will produce them or how you will reach a mass production that can be used in the clinical setting. No, is that you need to make sure that it will be useful, and it will be really able to be used in the clinical setting, and the biology will work in your favor, not against you. So. Well, yes. What I could say is that you have to, and for them, I mean, make sure to understand that the field is very wide in the kind of expertise that you require. I mean, it's not enough being an expert in biology, for instance. It's not enough being an expert in material sciences. It's not enough being an expert on chemistry, for instance, and so on and so on. I mean, at the end, the multidisciplinarity that it's required to design a good nanomedicine, it requires a lot of different expertise. And sometimes it requires a lot of big teams with a lot of people with different expertises. But my advice to young people that now takes into the field is that do not contain yourself with just knowing a lot in your very specific field of expertise. I mean, open your mind and try to also learn as much as you can of other fields of expertise, because that will for sure help you to be better and to design better things, and perhaps you will do a much better work and job than we did. I mean, so that we're doing. So that's the goal. So mainly. And of course, do not forget the biology, which is behind. And that's probably the most important thing. I mean, there will be for sure many advancements in many things. We will be seeing, you were asking me about the future. So I think that theranostics will be advancing too, the use of, just to mention some, no? But as I was saying, the use of systems to inhibit intracellular targets, to immunomodulate this in the immune system, the immunotherapies and vaccines for cancer, for instance, and for other things, no? Delivery of proteins and in rare diseases and non-viral enzyme replacement therapies. This is something that the use of extracellular vesicles and exosomes as delivery systems, this is something that is being seen more and more too. So, and RNA therapeutics, that's for sure. So those are, I'm sure, different types of developments that we will be seeing a lot in the next few years. That's for sure. Yeah. So these guys, that they come into the field I mean, they have to be aware of that, and they have to try to expand their expertise in the different fields that they require to make sure that they understand all these developments, and they can actually join the teams and contribute to the science as probably we cannot always do.